It's the I Can't Mom Today podcast with Heather, the new mom, and Vera, the seasoned mom. I Can't Mom Today.
Hey, this is Vera and Heather back again with another episode of I Can't Mom Today podcast. Hi, Vera.
Hey, Heather. How's it going?
It's going good. It's the second or 17th Monday of 2001 or 2021. I can't see. It's 2001 still.
If only. It does seem like a long year already, doesn't it?
It does. It does.
It's okay.
So, but how's it going?
Oh, good. I'm just chugging along, trying to stay warm, even in Florida. It does get cold. And well, North Florida, as we know.
Yeah, Texas got snow. Like real
I
snow.
know, it's crazy. The weather has been absolutely insane. So, you know, again, not as cold as typically as Colorado, but still North Florida does get a little bit chilly.
Yeah, it's nice. I love the cold.
How are you guys? How's Baker? How's everybody?
It's good. We had a long weekend. Baker, Brad had Drew, and I love my son, but he is a handful.
He's a three-nager.
Oh my goodness, yes. And he doesn't stop. Like if he stopped for 2 minutes, he would fall asleep, but it's those 2 minutes getting him to stop, and he just can't. He doesn't.
It's okay. This too shall pass. That's what
I know.
you can always say with kids.
When I think about it, because people are like, oh, well, when they get to become teenagers, they won't ever get going, essentially. So I have to remind myself, like, there's going to be a time he slows down. You're just going to wait for it. I don't want him. I can't fast forward that slow down time because I don't want him to become, a couch potato.
No. And as the mother of a teenager, I can say they are definitely sofa spuds. Yes. In fact, getting him up before noon on the weekends is pretty much impossible.
Yeah.
So,
cool. We have a very special guest today. We have Dr. Auguste.
Auguste.
I want to say August. Oh, I'm so sorry. I'm terrible. Auguste. It's like a gusty wind.
There you go.
Exactly.
Perfect.
Yes. Who has been an OBGYN for since 2014 or 2004. My dates are all off. And she's been a fellow at large with ACOG, which is the American College of Obstetricians and Gynecologists for around a year. She is part of this book that is extremely large, but it's probably lighter than your baby.
Yeah.
When it comes. And it's about your pregnancy and childbirth. And I had the opportunity to go through it this week. And I have some questions, but do you want to address the book first?
Well, tell us about yourself, Dr. Auguste. Do you have children? Tell us about yourself.
So, well, thanks for having me. You guys are fun already. I'm here cracking up. You guys are great. So I'm really excited to come and represent ACOG and talk about the book. I, like you mentioned, I've been practicing OBGYN for almost 17 years in Washington, D.C., and I've been very involved with the American College of Obstetricians and Gynecologists. I'm their fellow at large for a little under a year. This is like the irony. I don't have children, but that's okay. I love to birth them and give them off. So that is great. And so all of your stories about what did you call it? The toddler teenager?
Three-nager.
Three-nager. That I'm going to use that one because that's hysterical. So I love that one. But yeah, I'm really glad to just be here today, guys, and just kind of talk about the book and, answer questions and, get some more information for all of your listeners.
Awesome.
So I'm just going to, Vera, you had a great idea to talk about COVID, and I think that's a great start. And then my questions are completely random from like when I was flipping through the book, I'm like, so let's start out with more organized and then we'll go to my unorganized.
Okay. Well, yeah. So I was thinking, obviously, in this day and age, we're all dealing with the pandemic. And I noticed, too, that in the book, you guys allowed for that. There's actually a section about COVID and pregnancy. And I'm sure a lot of women who are either contemplating getting pregnant or just getting pregnant are pregnant. There's a lot of concerns about still birthing in hospital and the dangers and the precautionary measures that they should take. So can you touch on some of that? I mean, I guess just starting from doctors and hospital visits while you're pregnant, is it really safe?
Sure. So, the pandemic is something else. It has, we couldn't even imagine this happening in this day and age. But for women that are pregnant, thinking about getting pregnant, it really comes down to being a very individual decision. There is no absolute rule, rhyme, or reason about COVID and pregnancy. It's a discussion that each woman should have with their doctor about whether or not, if they're planning future pregnancies, what that looks like in COVID. If they're currently pregnant, you need to talk to your doctor, your midwife, your nurse practitioner, whomever you see. Talk to them about what the precautions are around COVID. So any pregnant woman should be just as cautious as someone that is not pregnant. Social distancing, wearing masks, hand washing. Don't go to gatherings without, inside or outside. Pregnant women get COVID. Pregnant women get sick with COVID. We don't know a lot yet about the effects of COVID on pregnancy and or the baby. We're learning fast. But again, it's not like we have 50 years worth of data that we can say. So we're kind of learning on the fly. So some things that we've known is that in the beginning of the pandemic, we did not think that the virus was passed through the placenta or anything like that. Now, after almost 10 months of the pandemic, we're starting to see a little bit more regular occurrences where antibodies are seen coming through the placenta. So we don't know what that means yet. We don't know if babies are getting infected in utero. We do know that the virus can make it to the placenta and through the placenta, but we don't know what that means. More to come on that. It's not a very satisfying answer just because, we're still learning too. The methods of what we can do right now to treat people with COVID, you've heard all the different types of monoclonal antibodies, steroids, all of those things we can do in pregnant women still. So that doesn't change. Do pregnant women get more sick than non-pregnant women? The evidence is still out there. We've seen pregnant women do really well with COVID. We've seen some that not do well. So I think it's still yet to be determined. Again, not very satisfying in terms of absolute answers, but the takeaway message here is really have a discussion with your healthcare provider, whether you're thinking about becoming pregnant. What does that mean? There's so many factors to think about. Your fertility planning shouldn't just be based on COVID. You have certain personal situations that need to play a role here, and that has to be weighed. All the benefits, pros and cons and risks have to be weighed together. And I think the best way to do that is for women to talk to their healthcare provider so they can give what are the rules and regulations around COVID in that particular hospital, in that birthing center. What does that look like? What precautions are they taking there? Do they have telehealth services? So all of those things. So I think that's the best route to go with right now, just because, we're still learning and it's coming hot off the presses in terms of what we know. We are trying to get it out there to the public, but essentially it's 10 months of a newfound disease that we're trying to figure out.
That's the scary part. I think that's for a lot of people, we just don't know what to expect. And unfortunately, even the experts don't know what to expect exactly.
Well, I think it changes so often that you could say one thing one day and then 3 weeks later, it's not relevant. It's not the same because things have come out. When people were, at the beginning it was like, you don't have to wear a mask. And now it's like, you should wear a mask. So, now in the book, they're talking about some vaccines like MMR and
messenger RNA.
No, MMR, the measles, mumps, rubella, and different vaccines, and holding off on getting pregnant during that, the 1 month after you get that vaccine. Now, based on what we know right now, would that be something, because I know there's this vaccine's rolling out for COVID, based on what we know right now, is the general practice that people should hold off until they get until after they get the second round, like a month or whatever, to start planning or start getting pregnant?
Great question. So the issue with of all vaccinations and pregnancy is whether it is a live virus versus a non-live virus. So those vaccines that are live viruses, like the MMR, you should definitely plan appropriately and prevent getting pregnant around when you receive that vaccine. particularly for the COVID vaccine, unfortunately, more of the same. None of the studies involving the current COVID vaccines that are out there were done on pregnant or lactating women. So we don't have hard evidence. However, we do know the science behind the vaccines that are currently out there. And those are not live vaccines. So based on the science, it should be safe in pregnancy and lactating women. So again, it's have this conversation, talk about it with your provider, just so we can talk about what are your concerns, what we do understand right now, and then together as a shared decision-making process, you can make your decision as to whether or not the vaccine is right for you at this time.
I do remember now that you said that, saying like having the live in the
vaccine.
In the vaccine. Now, and this is to speak to, so people, I've seen people on the internet, the internet's crazy and just crazy right now. So people have said, oh, well, it's not good for, if you can't give it to a pregnant woman, or if it's whatever, then it's not safe. And it's like, no, a lot of drug manufacturers and a lot of, people don't like to do testing on pregnant people or those that are lactating, or even like children under 2, because if there's a side effect, that is so dramatic. And so it's not that it's not safe. It's just that they don't want to do that testing, because if something happens. And so I think that's what people fail to see is that, and I'm sure there's a lot of regulations as well. It's not that the manufacturers themselves are like, no, we don't want complications. I'm sure there's some sort of federal regulation.
There's a lot to consider, and pregnant women and small children are kind of like the hands off, taboo. Let's not do anything to mess them up, kind of thing. ACOG is making a big push to start to include pregnant women in some of these drug trials, because pregnant women are getting sick and we need to know how it affects us. So, we'll continue to fight that battle and work with drug companies and scientists in terms of bringing in pregnant and lactating women into some of their studies. But what we do know is the science on how the vaccine works, and that's what we're going with. Yeah.
Awesome.
That makes sense.
Vera, do you have any other questions about COVID, so I can get into my random questions?
Heather's been sitting here like, do. I've got the fun questions. Where can we have the fun questions now?
I knew that I would forget them. But they're really like, this is how my mind works.
Okay. Yeah, cool. It's a little scary. Don't be afraid, Dr. Auguste. There you go. Go ahead, Heather.
So in the book, there was about STI testing, and that if you're under 20, or if you're 25 and under, you should definitely get tested for chlamydia and gonorrhea, unless you have these other check marks like new sexual partner. So why is it on 25 and under? I'm sure there's some kind of medical reason, or just that riskier lifestyle 25 and under, because people's brains haven't finished developing.
Basically, that's it. Basically, it's just social standards and just behaviors that we see. We see folks that tend to be 25 and under have more sexual partners. They might have a freer being around sexual activity than those that are a little bit older. I think that is a thought process that many would challenge nowadays, but that's okay. Again, I think it's just, have that conversation. It really could depend on just what your lifestyle is and what things that you're doing. Being honest with your provider and being honest with yourself first and saying, I should probably get tested, or maybe I shouldn't, I don't need to, but, it's been a great year.
Yeah. And your provider's not judging you either. And I think that's such a big thing.
There's no judgment. Yeah. That's what I tell a lot of my women, like, you want to have sex? Great, fantastic. Have lots of it. Protect yourself. Tell me what you're doing so we can take care of you. No judgment. And I think, and I hope that women have that relationship with their gynecology, or the gynecologist or the obstetrician, where they can be very front and open. Because just as you tell us, I will say, okay, great, let's go ahead and test you for this or for that. Now you know how you can protect yourself. Make sure that you do it, and enjoy sex. And that will open a conversation about sex too, just to make sure that a woman's sexual health is something that she feels comfortable talking about. And things to look out for, things that may be worrisome, and to make sure that she's enjoying sex. I think that's part of the conversation as well.
Yeah. I mean, like
love
for
that you
me,
said
like
that.
I get tested every year, no matter, or whenever I get my pap smear, because I'm like, you know what? We don't know. What's the harm? Why not? You know? And I trust Brad 100%.
I was gonna say you're trying to catch Brad. That's her husband.
No.
Trying to catch Brad in something.
No, absolutely not. But like, it's just like, what's it going to harm? You know, like, I don't know.
Well, yeah. While you're in there, might as well.
You know, like, what if a toilet seat gave it to me? I mean, you know, I know it's reasonable, but at the same time,
we have those conversations too about toilet seats and how they're not giving you anything. But those
are you sure?
Conversations. Those are the myths that we dispel. As long as we're talking about it, that's the kind of stuff that we talk about. So.
My friend's cousin's sister's uncle, brother said that they got it from a toilet seat.
Yeah, from the Waffle House toilet seat. We just got it.
Now in this section where it said male or sperm lives in the female's body like 3 to 5 days, I believe. And so my question is that I've heard rumors that male sperm goes faster but the female sperm live longer. Is that true?
Cricket.
No.
Okay.
So you're talking about sperm that has female chromosomes and then sperm that, no, all sperm the same.
Okay.
They all
because
spend the same.
That, like if you want a boy, you should have like have sex like whatever. Okay, no. So do not live by that.
Mythbuster right there.
You're welcome. It's hot off the presses from here. I came on Today podcast. And then there was one part talking about ovulation and like tracking your ovulation, and they gave some examples, but are there like specific tests or like specific types of thermometers and all that kind of stuff that you should be looking at purchasing? Should you buy on Amazon? I mean, like, is there a better place to buy that's not like, I don't know, because vitamins, you don't want to buy vitamins off websites because you don't know if it's real. So is there a better place to buy these things or track these things and stuff?
Sure. So, currently right now where we are, ovulation predictor kits, so some of the tests that you're talking about, the commercially available ones are all pretty good, pretty standard, right? So there's not one that's better than the other. And there's no special thermometer that would be needed. Checking your body temperature, any thermometer would do. You don't have to have a very special one. So I don't want anyone to be too gimmicky or this is made just for ovulation. Any thermometer works. Those commercially available ovulation predictor kits that are out there, like I said, they're all pretty good, pretty standard. They work. Excuse me. The biggest thing that you're going to have to do is to track your cycle. That's the one biggest thing I ask women to do. Day one of your period is day one of your cycle, and then start keeping track of how many days you bleed, what day it is. And then after a couple of months, if you have regular cycles, you should start to learn your cycle a lot better. And you would pretty much know when you're ovulating. The ovulation predictor kits will help you. So I think putting all of that together really gives a woman a great shot of figuring out when she's ovulating.
Well, there are apps too. I remember that there are apps where you can track your cycle and they're free.
Yep.
Apple has one of the health thing.
Oh yeah, does it?
Yep.
Check you out.
And so again, those apps that are out there, I would read the reviews. Some are better than other. ACOG is a great app. Plug for ACOG too. So some of their apps are really good too. So it just kind of depends. Again, there's not one that is like the best, the golden one over all of them. And again, I think just a matter of kind of putting all the information together, and you'll start learning and seeing how your cycle works in the body. And if you do it long enough, you'll notice when your cervical mucus changes, when your basal body temperature might be a little different. And some women get very good at recognizing the signs and symptoms of ovulation.
Nice, but
cool.
Never mind. I'm not going to say that. Never mind.
I don't know if I even want to know.
I was just some religions don't believe in birth control, and yet some people were very good at only having like a couple kids.
Well, some people figured it out. Yeah.
Yeah. So I feel like some faiths might have a better tune into that charting. One part in the book said that you shouldn't eat while you're in labor. My hospital let me eat, but I was progressing really slowly. And so I don't know if that's the reason, but it all came back up. So be wary.
Yeah, so the issue with not eating during labor, it's not so that we starve you or anything like that. A lot of times during labor, fast or slow, cervical change could cause some nausea, some vomiting. That happens too, right? Some women know it. Like as an obstetrician, I'll see a woman in labor and all of a sudden she starts vomiting. I'm like, you're 8 centimeters. Things are happening right now. I can tell. So as the cervix dilates, sometimes it causes nausea and vomiting. Then also, God forbid that there's an emergency. Sometimes if we have to use anesthesia, it causes overwhelming nausea and vomiting. And the key here is in those situations when a woman may be in labor, she might be supine or laying down or, getting rushed for an emergency C-section and she has a full stomach, that vomiting, you may inhale your vomit and that could cause a pneumonia. So that is why we don't want women to eat during labor. That is the premier reason. There's no other reason. We're not trying to be mean. We're not trying to not eat. It has nothing to do with having bowel movements during labor. It's not that. It's to protect against what we call aspiration pneumonia in case that happens. That's what it's about.
Interesting. Yeah. I was like, I think you can eat. I'm like, this is delicious.
Yeah.
And then I didn't know. Like, I was just like, I'm normal. Like, I was sitting there and all of a sudden I was like, I don't feel good. And I was like, bleh. I was like, they're like, we're going to give you a thing. I was like, I don't think I need that. Like, I don't feel very good. Within 15 seconds of getting that bag, it was all
good. Well, I was starved. I had 32 hours of labor, so I was ready to eat my hand by the time my child finally came out. I was like, okay, now where's my grilled cheese?
Get me. Now, something that I was really upset about that I didn't know happened, and I'm so upset with doctors for not telling us this, is that they massage the fundus. I had another mom tell me, and I was like, I'm sorry, what they do what now? And when they did it, I was prepared, and it's painful. It's not something that you're just like, this is a walk in the park. Like, I was prepared, but had my friend not told me, I would have been so angry with these people for not telling me.
Oh, sure. So so Heather, what you're talking about is after delivery when they they call it massaging the fundus.
It's like shove really and move.
Like rubbing that so it's the fundus, the top of the uterus. And why this is happening is because after you have a baby, sometimes the uterus, which is a large muscle, gets a little tired because it just had a baby and everything. So sometimes it's not very firm, it's loose. And when that happens, it bleeds. And so when we rub the fundus, we kind of cause the uterus to contract down, and that prevents any excessive bleeding. So that's what happens. So if after delivery you're bleeding more than we like, we're going to be massaging the heck out of that fundus to try and get it to clamp down. And it always comes with, I'm really, really sorry. I know this is uncomfortable. I'm really, really sorry, but you're bleeding more than we like. We want your uterus to clamp down and stop bleeding. So that's what it's for. And that is also a good check to make sure that the uterus is a normal size for after delivery, because if it's also really large, then we're like, why is it so large? Is it filled with blood? Are you going to start to hemorrhage right now? So it's all around the risk of hemorrhage and bleeding and why we're checking the fundus.
All good reasons. And so
note to self, let's talk about that with the patients. Note to self so they can expect that that's going to happen.
Yeah,
absolutely.
I'm glad I was prepared, but
well, because I had an epidural. I was going to say I had an epidural, so they could have been massaging funduses all over the place, and I had no idea.
No.
Even with an epidural?
Yeah, no, because it's before. So they only did it twice to me, but it was before I was let into a regular room. They were like, we have to make sure you're, whatever. They could have told me there was popcorn in there. I don't know. Like, but I was just like, oh, okay, I'm ready for it. Let's do this. And so, so I think they only did it to me twice, but you would know, you would know.
See, I must have blocked it out.
It's like above where that, I don't know. My epidural was wearing off anyway. And they were like, just hold on. We'll just 1 more minute and we'll give you some more. I was like, I'm lying. But yeah, because the epidural wears off really quickly once you're unconnected to it.
Unconnected.
And then my last question that I have from the book is I was looking at the different types of multiple births and like how there's like twins and then certain sacs, different sacs, same placenta, different placenta. And how does a birth work? And really on both sides, when it's an identical twin, they're in the same sac. Or even when there's
Sure.
different sacks, like how does that work? Like,
So you bring up a really great point. The type, when you have multiple gestations or multiples, more than one baby, twins, triplets, quads. We're not going to talk more than quads because that gets into crazy land. But what happens is, think about the amniotic sac that the baby's in. Sometimes when there's more than one baby, there can be two babies in one sac, or there can be two babies in two sacs in your uterus. And so it's completely how the egg splits. That's all that determines that. There's nothing you can do to predetermine that. And based on whether it's two sacs, one sac, one placenta, two placentas, sometimes the mode of delivery, whether it's vaginal or C-section, is better for the babies. I have to tell you, one placenta, one sac and two babies inside is really risky. And those babies probably will be delivered by C-section. Again, it's a conversation to have with the healthcare provider. They'll answer questions as to why, what alternatives there are, if there are any to try for a vaginal delivery. But each type of multiple pregnancy comes with its own set of risks. And so it's important for moms to understand that and why physicians, midwives, nurse practitioners are talking about that, and why we're bringing up when you're 20 weeks, we're talking about, the mode of delivery already, because it is so risky and associated with the multiples. That's why we have to talk about it early and kind of wrap our head around how we're going to deliver the babies.
Yeah, because I know there's a certain time frame that they like to get babies out. And so when there's two, it's like, in the same sac.
Yeah.
But delivering two placentas, I think, would be gross.
And two in the same sac, the two babies get very tangled upon one another, and that is the risk. That's one of the risks.
That makes total sense.
Like, no, I want to go without you.
Yeah, right?
Exactly.
Oh, that's so interesting. And I didn't even know that those were different things. Like, I just assumed, I guess, everybody had their own home and life support.
We would like for everyone to have their own home and life support. Sometimes it doesn't work out that way. So.
Yeah. Interesting. Okay. I think my questions, random as they were, were answered.
They're good questions, though. They're really good questions.
They were.
Yeah. Things that we wonder about. And I'd totally forgotten about the fundus or whatever it is.
Yeah.
It's been that long.
Well, I think had someone not specifically said to me, this will happen, I would have not even thought about it. But because somebody's pointed it out to me, now it's my mission in life to point it out to everybody else.
And it's one of those things that I got to tell you, as a provider, we kind of just take for granted, right?
Yeah.
Because in my mind, I'm 5 steps ahead. Like, she is not going to bleed. Like, no way, I'm not going to let that happen. And I'm just like, I'm massaging. We're not having bleeding. Meanwhile, bypassing the fact I am mashing on her just delivered uterus and how uncomfortable that is. So I think it's good to kind of talk about it, bring it up, have the patients talk to their providers about it so that we can have that conversation beforehand in the office about, hey, this is what you can expect, or this is not what, don't worry about this, or this is why we're doing it.
But even birth classes didn't do it. I had to go to so many birth classes and none of them told us that. And I was like,
I don't know. I kind of felt like there are some things that they withheld in the birth classes, just so you wouldn't freak out. I really do.
I feel like they've changed their tune in the year since your child and my child.
Well, yeah, because my son, Dr. Auguste, my son's just turned 18. So it's been a little, and Heather's son is 3. So a lot's changes in 15 years. And I don't know. I felt like they didn't talk enough about the recovery. Because unfortunately, my son came out like the Statue of Liberty. Like, he was, first of all, facing sideways and then put his hand on his head and twisted his elbow out as he was coming out. So everything was torn, the whole thing, whatever you call that. So there was a big recovery. There was a lot of stitches. In fact, the nurse wasn't allowed to sew me up. The obstetrician pushed her away and was like, let me do this. But anyways, the thing is nobody said, yeah, it's going to hurt to pee. It's going to be, you're going to be really sore down there. You're going to have to make sure it's all clean down there. Like, I wasn't prepared for all that, in addition to taking care of a new baby and trying to breastfeed and, whatever.
I think now I think now when we have those, when a woman has a significant tear or laceration from childbirth, that there are definitely more focused conversations about what to expect. I know I do. I definitely say, so that first time you pee is going to really burn really bad. And then we kind of talk about it and things you can do to help. But I think we're definitely talking about it more. I think as time has evolved, I don't know, and Heather chime in, I think as time has evolved, even the conversations that patients are having with their providers has evolved and changed and gotten a lot more open and freer. And that's what we want. You know, I mean, you hear a lot that before, back in the day, I said way back in the day, it's, you know, you go to the doctor's office and the doctor tells you something, it's whatever they say. I mean, that's the worst kind of care right now. Now it should be, you go to the doctor's office, you have conversations with the doctor, you decide together as a shared decision-making model is the best things for you. The doctor gives the clinical recommendations, you talk about what you want, and together you guys come up with a plan. That's what should be happening.
Well, I think also doctoring has changed over the years too. I think it was more of a prestige, not that people didn't want to help back in the day, but I think being a doctor was more prestigious, not that it isn't now. And it was a lot was they were looking for prestige versus helping people. And so like, I'm the expert, I know what I'm doing versus like, yeah, this is your body too. Absolutely. Let's talk about it. You know, I think it's the communication has evolved since the beginning of positioning.
Thank goodness. You're so eloquent today, Heather. I understand.
I get my way with words.
We all have our days. So the book, so like Heather said, I mean, it's a big old book, but I think that it's big because there's so much information to be had. It's called Your Pregnancy and Childbirth Month to Month.
Yeah, I think one of the great things is that it does go through month to month. And I mean, Heather, I loved your questions, but they were kind of random, but they were the kind of things that women ask about, right? No, but you know, it's not just, I can go into any book and find out those answers. This is very unique to exactly what our patients are going through. So you can answer those type of questions. Those are important. So I think that this is a great book and a great way to learn and figure out, oh, you're going to mash on the uterus that just gave birth? That's going to feel fun. Those kind of things. Yeah, absolutely.
And I think what I like about this book too is that it's not, because when you become a parent, you want to read every book, you know, and you just comb over it and you read into everything. And I don't think this book put a lot of gloom and doom. Like other books I've read where it's like, oh my God, basically my baby's going to die no matter what. Yeah. And so like, and that's what other books make you feel. And so this didn't make me feel anxious and like everything I do is going to be wrong. Like it was very actually comforting. Like you know, this is normal. Everything's normal kind of thing. But yeah, I think it really helps. It helps women to manage expectations and know what to expect, which is, I think, more than half the battle around pregnancy, delivery, and afterwards is really managing those expectations.
Yeah, the fear of the unknown can just create all kinds of anxiety. So, but if anybody wants to ask any other questions or reach out to us, you can email us, ican'tmomtodaypodcast@gmail.com. We're on Twitter, Instagram, Facebook, I Can't Mom Today Podcast, YouTube as well. Those are all the platforms. TikTok, which we're kind of on. So yes, please feel free to reach out to us. And if you have any other questions, I'm sure, Dr. Auguste, if we get some questions, maybe we can have you back some other time if we get a little collection of questions from people.
Absolutely. It'd be my pleasure. You guys are fun. I would talk to you guys every day.
Yeah.
We appreciate you taking the time to talk to us.
Yes. Thank you so much.
Absolutely. My pleasure.
All right. Until next time.
Bye.
Bye.